Okay, so we're going to put some Silver Diamine Fluoride on your cavities today. Some cavities in the upper teeth that are big and open, and some tiny little cavities on permanent teeth, and we're going to treat both of them with the same medicine. We're ready here, laid back. We've got our light. We have our plastic lined bib to protect his shirt from stain, and a eye protection to protect his eyes. Over here on the tray, we're already set up with our air, water, and saliva ejector, and then on the tray area, we have a plastic lined cover to prevent any stain from coming from the silver stuff onto the counter. We have plastic Dappen dishes for Silver Diamine Fluoride. Glass seems to be okay for silver nitrate, but for silver fluoride you want to use plastic. We've pre-bent our micro brushes that we're going to use to apply the silver fluoride. We have some cotton for isolation, and we're going to use the varnish to help just cover up, which I'll explain in a little bit. So we're going to go ahead and dispense, dispense 2 drops of the Silver Diamine Fluoride for the different teeth that we're going to treat. Make sure we have enough. There we go. Great. And then we'll also dispense the varnish so that we have it ready. Awesome. Okay, so first step is isolation. You want to do the left side or the right side first, buddy?
Right side.
Right side, you got it. Okay, so we're gonna do the top. If you can put your chin up really high, up, up, up and away, cool. And I'm gonna put this little pillow, this little soft thing, and way up here. If you could close down and open, perfect. Good, good, good. There it is. Just roll that back to protect from saliva, and open a little bit. There we are. And so now we have our accessible cavity on the distal and occlusal of B. You can see there's some moderate erosion on B as well, indicating most likely gastrointestinal reflux. And then if you could open just a tiny bit bigger, is that okay? We have our wind again, so I'm going to dry just the demineralization early cavity on number 3. The point of drying is to maximize the amount of silver fluoride that's going to soak into the lesion. Now we're going to wet our brush with silver fluoride. I like to agitate it a little bit to get it throughout. Remove the excess on the side of the Dappen dish. Be careful not to touch the lip to stain it, and start applying. I always go for the deepest part of any of the cavities first, because that's the most important, I think. Then I'm going to get a little bit more for the molar. The distal pits and distal lingual groove tend to be the ones that have the biggest problem. That's where I noticed a little bit of the demineralization. I will go ahead and touch the other surfaces since it's here and it's easy, just to protect from recurrent or new caries lesions that we don't really see. At this point, we can go ahead and cover with the varnish. One could use Vaseline, or one really could just use nothing, is fine as well. We've wet all the surfaces. I'm just going to double check that we did wet the surfaces with the material. And now I'm just going to cover the treated surfaces with varnish to protect the reaction. Our old protocol was to wait a minute and then rinse. And we've done safety studies now to show that we really don't need to do the rinse. We want to maximize the amount of medicine that gets in and stays in the cavity to maximize the effect. That is it for that quadrant. You doing okay, buddy? How's the flavor? Not good. Or you don't? No. So I'm going to put a little bit of water on your tongue to get rid of some of the flavor. And then we'll proceed